Throughout the COVID pandemic, decision makers have needed a rapid access to evidence to inform policy responses. The crisis have highlighted the need to be responsive in generating and drawing on existing high-quality evidence while dealing with high level of uncertainty and difficulty trade-off. It has also highlighted the importance of learning from both global and local evidence. The evidence community has come together in a variety of ways to understand decision makers' needs and make evidence accessible, building stakeholder networks, providing rapid evidence services, and developing evidence gap and portal are some of the many approaches used by evidence producers to support the pandemic response efforts. Today, we are happy at CEDIL to have you all here in the first day of the 4-day conferences. My name is David Safo Ameyal. I'm the President and CEO of the International Center for Evaluation and Development, and also for the past 3 years, I've been the chair of CEDIL Advisory Board. And I'm going to moderate the sessions for today and introduce the keynote speakers and the panelists who are going to lead today's session. I'm so happy to welcome you all to the first day of the CEDIL 2022 conference. I hope by the end of the conference, by the end of this week, we will be able to contribute, support, and utilize the way evidence can be used to make decisions. Without wasting much time, I would like to introduce our keynote speaker, who is Professor Adnan Khan, Chief Economic Foreign Commonwealth and Development Office, FCDO, as you know, we popularly call it. And he is going to give a keynote address today, and we hope that through his presentation, we will be able to learn a lot and be able to see how such an organization have used evidence. Professor Adnan Khan is the chief economist, as I have said, and he is seconded from the London School of Economics and Political Science, where he is a professor in the School of Public Policy. Adnan has focused his career on advancing the understanding of development economics, political economic, entrepreneurship, and public sector reform. Prof has taught courses at London School of Economics on development economics, public organization, and political economy. He has spent time teaching at Harvard Kennedy School, and he has also been an academic director at the School of Public Policy, in which role he has helped shape the school's vision and pedagogy. Adnan is committed to using economic analysis and research to achieve impact. He has used real-time, cutting-edge analytical work that feeds directly into policy and has also helped apply frontier research on regions conducted through deep achieve policy and academic impacts. Professor Khan is a co-chair of the London School of Economics Oxford Commission on State Fragility, Growth and Development. He continued to work on the theme of regular state through the following follow-up reducing work on the follow-up reducing initiative. He has published in top journals on issues like promoting value for money in public procurement, building state capacity by motivating civil servants to perform better, and on promoting entrepreneurship and social protection. He has served as a research and policy director at the International Growth Center at the London School of Economics, where he has helped research and policy initiative aimed at promoting economic growth through policymakers' research, collaboration, and by generating ideas based on frontier research on key drivers of economic growth, state effectiveness, productive firms, and larval cities. We are happy to have Professor Khan to join us. And as he is about to speak, we would like to remind all of you online today to write your question and answers on the question and answer menu, on your site. At the end of the presentations, I will moderate the question and answers, and the panelists and the keynote speaker will contribute to your questions. Once again, on behalf of CEDIL, I would like to welcome you all and also welcome Professor Adnan Khan to give us our keynote speech this afternoon. Thank you.
So this audience doesn't need to be convinced that use is important, but it goes far beyond just building and generating evidence, because there are market failures around generation, promotion, and use of evidence. Who produces evidence? Using what methodologies? What evidence gets produced, and more importantly, not get produced? And also thinking about barriers and constraints to use of evidence. We all know there are market failures around all of those. And all of them were clear during the pandemic response that we all experienced. Huge, massive effort from policymakers and other actors in addressing the pandemic. At the same time, we also saw, especially at the earlier stages of the pandemic, consistent and somewhat predictable challenges in the use of evidence. And let me describe a few. I work with a lot of governments, I'm sure many of you have, and I'm still working with governments on COVID response. And what was clear wasn't not just there was lack of knowledge and uncertainty, there was radical uncertainty, but what hindered policy response even more than lack of knowledge was a lack of a limited understanding about how to acquire relevant knowledge and capacity. In other words, learning to learn became a critical constraint. What I would call like having an active learning mindset, which is using the information that we already have, existing information, but how do you acquire more information? What hindered it was also siloed approaches, both in academia, where I sit, between different disciplines, but also between academia and policymakers. And within policymakers also, what was surprising and maybe not so surprising was different agencies and different policy actors adopting sometimes like contradictory or policies which are at variance with each other. And especially at the initial stages, there was a temptation to follow the herd, to, as one of my colleagues from LSE puts it, to go big and to do it fast. And one of the examples of pre-existing information, even in an environment marked by radical uncertainty, and I'm talking about the early stages of the pandemic, there is a lot of pre-existing knowledge that could have been used and eventually was used, but initial stages was available and could be used. So this comes out of work by colleague Jishnu Das and others about the variation in risk of hospitalization across different neighborhoods in Delhi based on pre-existing conditions. Information that could be used for both population-specific, area-specific, and other pandemic measures that are targeted and not just blanket measures. Still another example, age distribution in Italy is completely the reverse of the age distribution in, say, in Pakistan. And do we need to have similar policies, or do we need to have age and spatial targeting? Something that eventually policymakers figured out, but at the initial stages was harder to do. So I'm just going to describe one such collaboration between policymakers and researchers that I was part of, just because to share what we learned, the strengths and limitations of that approach, based on both an international collaboration between universities, Harvard, LSE, elsewhere, but also policy actors and actual governments in India and Pakistan, in this particular case, several governments, but also academics and researchers from different disciplines, public health epidemiologists, economists, and tech people and others. The idea was to work in real time with policymakers in addressing their needs and constantly updating it. And we started in March 2000, about 2 years ago, exactly 2 years ago, in fact, something which is still continuing. And so we both established certain principles. So one of the key principles that we established was, if we have to address this challenge of this pandemic response, active learning has to be a key part of it. And by that, I mean, basing our policy response on the knowledge and information that we have, the data and evidence that we have at this point in time, but also taking actions that speed up learning, that actively taking actions to gain more knowledge and then to refine policy response based on that knowledge. Nothing that we invented in social sciences, especially in economics. This builds on the approach that Charles Mansky and others had, policy making under uncertainty. But all we were trying to do it was putting it to use in a particular situation. Practically, it meant, because we also work with governments and in real time in utilizing and acting on it, was collecting representative outcome data at a very regular intervals on both COVID, non-COVID, socioeconomic impact, through smart testing, robocall, all kinds of ways, in order to address knowledge failures in real time and break decision deadlocks. So using evidence and updating evidence, not just in one point in time, but continuously and regularly. The other principle that we were working on was to have response that is not common, uniform, or blanket response across all areas, but also varies spatially as per different regions in terms of the needs of different regions. This is common knowledge now, but back in March and April 2000, there were not too many actors who were convinced of this. In other words, having a localized and targeted policy response. And then grading, having a policy response that is not blanketed, but that also varies with the level of, in that case, like both positivity or underlying socioeconomic characteristics of different grades. Again, something which is now regularly done all over, but wasn't common knowledge, at least at that point in time, 2 years ago. Practically, how we did it was working with the government, and so each of these blocks that you're seeing are census blocks. In a city, in a province, more than 100 million people. In a city of more than 10 million people. Each of those blocks are census blocks of 200 to 300 households. So basing response, a targeting response to the situation of each census block. And as you can see, like these color coding are in terms of their positivity rates that we also tested through smart random sampling, that a blanketed response would not work because areas differ hugely in terms of their needs. You have areas green which are not affected, bordering areas which are mildly infected, and other areas which are heavily infected. So we need to have a tailored, very, very localized response, was what was revealed through this exercise. Again, another way of doing it at a city level, building it from a very, very small unit. Still another example of, as I mentioned, we did smart random sampling, because if you only do random sampling, the power calculations will be such that you'll be wasting a lot of resources. So that's not what we did. using this information in real time in order to address whether a lockdown or other measures were working or not in terms of health outcomes. And at the later stages of this, testing positivity rates and then basing policy response of both the health ministry and other ministries on it, both on symptomatic and asymptomatic, varying by gender, age and gender across different areas. What we quickly discovered was one of the key features, one of the key data, call it sufficient statistics, which was used by policymakers, which was positivity rate, needed to be unpacked because of huge variation that I'll quickly share. So the positivity rate hugely varied by lab type, by whether public lab or private labs. And that's a measure of partly selection issues in social sciences, as you know, like who chooses to go where. And also by what kind of kits were being used by different labs. Huge variation in those, as you can see. And in terms of sample selection, who goes where? In terms of private labs, in terms of whether we are testing the context, or whether we are doing it in a smart random way. Which one would you trust more? And how much of the variation in positivity rate that you're getting is a function of testing, selection issues, and others, and how do we correct for those? This is something that we worked with the government on for quite a long time. To finish off, this is not to say that this is a great example of how to do it. I'm sure all of you, many of you have been engaging in similar type of exercises. This is just an example that I was personally involved in for over 2 years, still continuing, where I think the key lesson was two: collaboration between different disciplines, academics and researchers that do not normally talk to each other. As I mentioned, social scientists, public health, epidemiologists, and others who built on each other, and between them and policymakers. And the second big principle was doing it in real time, generating evidence, messy though it is, and updating your current knowledge based on that information, updating the policy response, and then taking further actions to further gain more knowledge and to update the policy response based on that knowledge. Many lessons that we learned from this that I thought are worth sharing, and we have written about it, and happy to share more about this if need be. So what I at least took from that exercise, which is still ongoing, is if we need to strengthen evidence use for pandemic response, I would roughly say 3 things are needed. So adopting an active learning mindset, as I said earlier, basing on our actions, our policy response based on the information and data and evidence that we currently have. And even in environments marked by radical uncertainty, we always have some existing information that we could be using. But also taking action that speed up the learning that is needed, and updating and refining our policy actions at the basis of it, and using it as a continuous feedback loop. Preparing data infrastructure. Going forward, we could do much better in terms of preparedness for future pandemics, in terms of preparing data infrastructure for evidence-informed crisis response. In other words, establishing pre-existing data infrastructures, ideally geocoded, creating protocols to activate, access, and revise these in real time, and create pragmatic and flexible plans and structures for using this. CEDIL is a great exercise, and I am hoping to learn from what other people are presenting, and I'm hoping CEDIL can help us in using and building our capacity for being better prepared for such crises in future. And the last issue that is very close to my own interest, my own research also, is addressing market failures in evidence use to organically build state capacity. And by this, I mean 2 things. One is, how do we endogenize evidence use to evidence generation, so that policy influence and use of evidence becomes endogenous to the generation of evidence. We know, in other words, how do we address market failures so that it doesn't become like, if we build it, will they use it or not? It becomes endogenous to it. And the second, which is even a more important question about, call it more of a political economy question, deep to my heart, is also, historically, we have seen crisis, either external wars or internal crisis, generating a sense of shared common sacrifice that under the right conditions has been used to build state capacity, to invest in state capacity in many parts of the world. Will we see this in the case of the current as an outcome of the COVID-19 pandemic? If not, how do we ensure we get it? How do we address different market failures to ensure that it leads to this outcome? Thank you very much. Let me stop sharing my screen. I think I'm on time. I'll attend. The last thing I'll say is I will attend this conference as much as possible. I am looking forward to seeing the work that is presented. I'm a big fan of this work. Thank you.
Thank you very much, Prof. We really, really appreciate your time and the topic, giving us how to scale, and how lessons for strengthen the evidence use, and I like what you said about, evidence use and utilization becoming indigenous to evidence generation. I think is something that, we are aiming for, and we hope that we will be able to work on that one. And I'm glad that you are going to stay for some time on this one, because questions and answers may come after the panelists have finished their time. So thank you, and we appreciate the time that you have spent with us. We appreciate it.
Thank you very much.
Good. Yes, we are going to now go on our panelists, and we want to work within time. We appreciate the time used by Professor Nakan. He stayed within time, and we hope that our panelists also will stay within the time. We are going to have a panel session from now till 1:15, and then we will leave room for question and answers. So if you have any question, please do well to put it on the question and answer chat so that I will be able to talk about it. As you all are aware, this conference is being supported and is being organized by the Center for Excellency and Development, Impact and Learning. As I said before, the center was established in 2017, and is being funded by FCDO, the UK Foreign, Commonwealth and Development Office, and it has two primary objectives, and I'm emphasizing it again so that we will know the context that this conference is being framed. One, first objective of CEDIL is to develop and test innovative method for evaluation and evidence synthesis in international development context. And then the second objective is building evidence base on research uptake and use in decision making. Therefore, if you look at the topic that our panelists are going to discuss, is within our two main objectives: promoting evidence use during crisis. We have 5 panelists today with us. The first person in our session will be Harsha Dayal, who is joining us from South Africa. She is the Director for Research and Knowledge Management, the Department of Planning, Monitoring and Evaluation of Government of South Africa. The second person is my own friend, Timothy Lambaga, who is the Commissioner for Monitoring and Evaluation, Office of the Prime Minister, Uganda. Then we have Dr. John Weiss, who is joining us from Canada, and it's early morning in Canada. And when we were doing the background talk, he said that he loved working in the morning. And John is the director of the Master Health Forum, and joining us from Canada today. Then we have Dr. Howard White, who is a research director for the Center for Evidence for CEDIL, and he is going to join us today. Then we have Dr. Shetel Sarre, honorary visiting research fellow in tropical disease modeling at the Northfield Department of Medicine at Oxford University. Each panelist is going to do a presentation for 10 minutes, and then after that, I will take your questions. I've seen Lazaro hands up. Please, Lazaro, I will take your hands, if you can really write your question on the answer and question area, I will take it up after the panel presentation. So I will invite our first panelist, Harsha from South Africa, to give us a 10 minutes presentation. Thank you.
Thank you very much, Chair and organizers. I hope I'm audible. I have 10 minutes into which I can share my experience and lessons, so I am not having any presentation or just not to be fiddling with the PowerPoint, which I always have technological problems with. So thank you very much, and also for the introductions. But I think to just locate myself as a researcher and a knowledge broker within the policy space, it was most encouraging to witness how evidence in all its forms had taken center stage during the pandemic. So much of our efforts over the years actually came to fruition during this time. So for this reason, it is important for me to acknowledge the respective roles we play in making our evidence ecosystem adaptive as well as thriving at times of urgency. So I think in much of what I'm also going to be echoing a lot of what Dr. Khan has been saying in the introduction, because at the beginning, it was stated that COVID-19 has revealed the fault lines of societies at large. Characteristic of these crisis times and any crisis times, there are multiple priorities, multitude of needs, endless fears and anxieties which define the context which we found ourselves in. So effectively managing a crisis of this nature in all its dimensions depends then on the foundations and strength we had built over the years on which we were needing to draw from. So the evidence community was not spared. One of the earliest challenges observed, and I think this was echoed in the keynote speaker's address, was the unevenness in evidence capacities of the different sectors. The health sector in South Africa and internationally has demonstrated excellent capacity to generate, curate, synthesize, and translate scientific evidence for far advanced from the traditional practice of primary research projects.
Open for me there, slightly.
There's another sound. Am I okay? Am I audible? Sure. So this was followed by the environmental sector, yet the educational, social development, other critical sectors could not match up, making the availability of comprehensive evidence generation to measure change and impact difficult for decision makers. Timely evidence is dependent on management of evidence on a daily basis to transform them into knowledge resources, and especially using technology and effective reporting channels to feed information to those of us who are analyzing and integrating. Grassroots organizations actually became the extended arm of supporting and caring for citizens, but few were able to generate data for analysis and interpretation. The value of administrative data for us from the perspective of government, the administrative data sets in generating real-time information was greatly pursued by policymakers for purposes of research and analysis, yet the incompleteness, neglect, and poor quality of administrative data was the greatest challenge in rolling out public interventions for grants and cash transfers at scale. These are only a few challenges I have time in our direct experience to share with you, but it does lead us to understanding what factors influenced use of evidence positively within this time. In South Africa, strengthening of existing structures for evidence generation within the National System of Innovation was complemented with the establishment of new structures under the National State of Disaster. So technical committees focusing on economic recovery, social relief, and distress grants were hard at work alongside our health colleagues in generating evidence, both new and existing, on how the pandemic was affecting citizens and communities. Sector specialists had to learn from other sectors at the operational level, and this only started happening towards the latter half of the pandemic time. The Ministerial Advisory Committee, MAC, presents as an interesting example for us, as it was structured for health experts, but later supplemented by the Multi-Sectoral Committee on Social and Behavioral Change. This was in response to complaints of the exclusive focus on health by the MAC in managing the crisis initially, but the realization grew that the pandemic impacted livelihoods far greater in far greater proportions, and for which existing evidence could be factored in to the analysis but not available. A new structure called the National Corona Command Council was established, but was initially met with resistance due to its authoritative stance. However, after the second and third waves, consensus grew amongst critics, academics, and citizens that this proved to be the most effective option at a strategic level, both in managing our national psyche, as well as directing operations to mitigate the effects of the pandemic. The difficulty then is not unique to South Africa, and the implication on evidence generation and use was in balancing between the need for a rapid, authoritative, and uniform response nationally, with the need for experimentation, flexibility, monitoring, and responsibility and behavior changes at the local levels. South Africa and other countries on the African continent had the experience of major health burdens before, when HIV and Ebola hit our countries. Surveillance systems, the extensive network of community health workers, and tracking of affected persons is what our health systems were built on. However, this was still also compromised with the sheer numbers we were dealing with, timely action, and the need, and obviously the health workers that were also affected as a resource. The media played a critical role in promoting evidence during the pandemic in South Africa and abroad as well. While government had many protocols to go through, official media and journalists were most effective in translating and diffusing scientific evidence to citizens, the communities, and even to government. We observed in awe during 2021 how systematic review specialists trained the media in PICO terminology, something that's quite familiar with the audience today, in PICO terminology and methods to help build evidence capacity amongst the media. So decision makers in our experience were certainly overwhelmed with the sheer volume of evidence generated during this pandemic. Existing evidence at local levels was mentioned, and it was in high demand because it provided the necessary baselines needed to measure change after the introduction of specific public sector interventions over the period of time. Evidence synthesis products like rapid reviews, systematic reviews, and other enablers like evidence catalogs, research repositories, evidence maps, and other portals were in even higher demand. It was most encouraging to witness decision makers, even if it was trying to learn later on during the pandemic as it progressed, to become clear in understanding and expressing the evidence needs by actually requesting specific synthesis products. A recent example is in the high-level request by policymakers to understand evidence synthesis on the hot topic of trust in government, and this was a theme that was even mentioned in the keynote speech. The multiple sources of evidence, the value of mixed methods, and analytical and synthesis approaches in using both existing and new evidence in an innovative way for this product proved to be a major achievement for the entire evidence community. Timeliness was totally dependent on existing evidence networks and relationships. Impact evaluations are dependent on the luxury of time, and which we didn't have during the crisis. The pandemic had, however, pushed both policymakers, decision makers, and evidence producers to review impact methodologies and adopt theories of change where evidence is generated at every stage on the pathway to change. This is work in progress, and it's really being embraced quite strongly to supplement traditional methods of experimentation and RCTs. Global evidence was absolutely necessary for benchmarking and comparative purposes, especially in combining socioeconomic policy interventions and for setting standards and trends that was not documented before. Scenarios, forecasting, and modeling were the evidence types that helped design new policies, especially during lockdown regulations, and to be able to have that differentiated approach to vulnerable groups and targeted populations. So these are, just coming to a conclusion now, there were two terms that probably came up in every conversation over the past 2 years in South Africa, and I'm sure in other contexts. One is resilience, and the second was solidarity. These are both grounded in the scholarship of defining the role of the state as well as of society as critical social actors in achieving development priorities. And I say this also as part of our entire focus on state capacity work that was already mentioned. This was the interconnectedness that was needed at local and global evidence levels and in the way we were generating our evidence. At times, what connected citizens to each other was beyond and across context. It is in this spirit that I summarize my three inputs as lessons learned. One, evidence capacities regarding generation and use are enhanced by centralized structures that hold together, coordinates, and integrates the diversity of views and actions, while decentralized structures are also needed to ensure effective monitoring, differentiated approaches to implementation, and responsiveness to contextual realities. We need to move strongly into synthesis approaches and methods to deal with complexity and uncertainty, but also to achieve governance and inclusivity when it comes to evidence uptake. Policy number two, policy coherence starts with effective horizontal integration between sectors. And we have noted already the unevenness across the sectors. And it was clearly demonstrated with the focus on lives and livelihoods. And so evidence needs to contribute to the full value chain of the causal relationship between horizontal and vertical interventions. And then finally, we do observe currently continued and new challenges, like the current infodemic and uncurated evidence generation, which presents a high risk for us as evidence brokers and producers. This was even validated by our chief scientist, Dr. Abdul Karim, in noting the high levels of anti-vaxxers who are flooding the social media currently. So in conclusion, it is necessary to go beyond the what questions of evidence, or in convincing decision makers why evidence is important. This has been proven, I think. We have shifted into high gear by being responsive, innovative, collaborative, and attending to all soft issues we could not tangibly locate previously in the evidence ecosystem. I think that our test will come when we emerge fully on the other side of the crisis. Lo and behold, not with another crisis at hand already, when we get back to day-to-day operations and find ourselves in spaces where evidence use is not just the norm, but the culture of practitioners on the ground as well as decision makers. I thank you for your time and your attention. Thank you, Chair.
Thank you very much. I like the way you put the last sentence, that evidence use must be a culture. I think that is a very, very good praise to end to finish your talk. And please encourage the attenders, but in the Q&A, so that we can take it. I will go to an evaluation office of the minister for Uganda. So Timothy, you are on for the next 10 minutes. Thank you.
Thank you very much, David, and Chairperson for this session. And good afternoon, good morning, good evening, colleagues from wherever you are joining. It's always a pleasure to have the opportunity to share these interesting and important discussions with you. So what I'm going to do is I'm going to go through my presentation. I won't project it because I think it will be more, it will flow better when I talk through the slides as opposed to the formal presentation, but I can share the slides if any of the members are interested. So basically my presentation is based on lessons drawn from the experience we had here in Uganda, but also a number of studies. So first of all, I had the opportunity to work with the National COVID-19 Task Force, Interministerial Task Force, under the chair of the Prime Minister. And that task force had different layers, had a technical committee comprising experts from the health sector and the military and other emergency response institutions. And then political leaders, interministerial committee that was put in place to deal with the COVID. And I'm very privileged to have been part of the team that was supporting the Secretariat. So I'll share quite a number of lessons of how evidence generation, promotion, and use took place in the work of that task force. Secondly, we had a number of studies commissioned during the pandemic, but also shortly before the pandemic, and some studies that have actually now recently been launched, which I think are quite informative. And thirdly, we are undertaking an evaluation, a comprehensive evaluation of the Comprehensive Refugee Response Framework, the CRRF, here in Uganda. I'm a member of the reference group, and so I share some lessons on that evaluation meant to provide evidence to facilitate our handling and management of refugee programs. And finally, I also am a member of the management team for a global joint evaluation of the protection of the rights of refugees during the COVID-19 pandemic. This is a very exciting evaluation as well, looking at how the protection of refugees was handled in different parts of the world. So very, very quickly, in terms of what are some of the challenges and trade-offs in producing and sharing access code data and evidence? So the first lesson, the first challenge that I want to share here is that evidence required was not taken as a priority or was not even thought to be available. In our case, there is a lot of information that existed, but nobody knew that is available. And also lot of evidence that would be required later during the pandemic, which nobody thought was a priority. And I will just give an example here. During the pandemic, of course, governments, like several other governments, had to institute lockdowns. And when the lockdowns were instituted, we realized that there is a significant category of workers, especially urban dwellers, who live on the daily incomes. So they survive and earn their living based on what they earn on a daily basis. So because the economy was shut down, after a week or so, 2 weeks or so, they basically had no supplies. And so they became a priority target for support. However, it was a nightmare having to target this category of individuals. So that's when we started looking at the data we have on poverty levels, on the distribution of poor people, on urban poverty, and how to target these categories of people. And it then hit us that actually we didn't have adequate information to target and reach out to these persons. And this was a very, very big challenge, identifying who they are, how do we reach out to them, what is the most important assistance and support that they needed. So that was one challenge. The other challenge is now with the existing systems. While we had lots of existing systems put in place to deal with refugees, for example, in Uganda, we have a big refugee population. We are the third largest refugee hosting country in the world. And so we have quite a big program to deal with refugees. And over time, we have been developing mechanisms to improve the coordination of all the actors to respond to the refugee demands. But the evidence from the evaluation I referred to, again, showed that we had big coordination challenges when we eventually started looking at how best to target refugees and host communities. Again, in Uganda, the policy is that the refugees actually live with the ordinary communities in specifically designated areas. And in that case, they share social services, they share medical services, schools, and other social services. And so the comprehensive refugee response framework evaluation has showed significant shortfalls again in the coordination mechanisms. While each agency or many of the coordination frameworks are doing a great job, there are issues around consistency and completeness of the work that they do. And this again hugely affected the response to the refugee population. So those are two challenges that I can quickly share here. Then on the kind of evidence that was valued during the crisis, number one, of course, was to look at evidence that is readily available in order to inform decision-making. In the example that I gave on targeting the urban poor and the people from the informal sector, one of the quick sources that we looked at was data on mobile telephones, because at the end of the day, the assistance that was sent to them was a cash assistance that was sent through their mobile telephones. And so the kind of evidence that was really useful was evidence that is quickly and readily available in terms of also statistics at the local governments and the urban centers where they live. That was the first. Second was evidence that had a history of having value in the targeting. And in this particular case, we relied quite a lot on registration systems at the local council level, registration systems at the refugee camps as a starting point to build on. They had gaps, all right, but we had to start somewhere. So those are systems that had been used before. There had been some improvement on them and were quite handy in terms of being of use. And then the third part of the lessons that I want to share is around what factors influenced the use or non-use of evidence. One point here is the extent to which information generated is aligned to either an existing policy or a nationally known program or action. In the task force discussions for the National Task Force on COVID-19, it was very difficult for them to accept lots of contributions and data unless it was aligned to or related to an existing policy, structure, or strategy. In our case, we relied quite a lot on issues that are developed out of the National Refugee Response Strategy, the Disaster Response Strategy. The Disaster Response Strategy had a criteria that had been used before, which was quite informative. And there were several suggestions from many actors on a number of approaches, and that was not easy to be accepted by the task force just because of lack of knowledge about their value and use in the past. We had to rely on a social protection program for the elderly, information systems, which had information about their needs, their requirements, their location, and so on. Then the other factor is the accessibility and acceptability of the evidence. Acceptability, I have already explained, but in terms of accessibility, again, remember in a crisis, the decisions have to be made quick. So any effort to provide what requires further analysis or organization, especially the political leadership, are not willing to wait. Action has to be taken quickly, and therefore the evidence had to be evidence that is easily accessible and available at short notice. We had to undertake, for example, quick consultations on what is the most suitable relief packages to provide to the affected communities. And there was very little time available or provided for that. And so we had to rely on what could be accessed at short notice. Then the other point is, which I realize now, is a general culture of demanding for evidence. Again, in most of the national responses during the crisis, institutions that previously used and relied more on evidence were better organized in terms of responding effectively compared to institutions where the evidence culture and practice was limited. And across the sectors of government, you could look at the energy sector, the water sector, the education sector, the health sector. The health sector is very much used to emergencies and crises. In Uganda, for example, we have had outbreaks of the Ebola, Marburg, fever, and several other health disasters. And so within the health sector, it's very easy to put up a team. It's very easy to look for the information that is required to inform that team. It's faster to develop a response plan. The mechanisms and systems are already pre-existing. Whereas in other sectors like the energy sector, they have hardly had a crisis. And so it's kind of new thinking for them to start thinking about what evidence they will need and so on. As I come to conclusion of my remarks, let me speak a little bit about some of the lessons for generation, translation, and for use of evidence, which I pick from this experience. Number one is we have invested too heavily at the higher level outcome indicators, the global national indicators. We do beautiful regular surveys and provide that data. However, we have forgotten, or we have done very little on the lower echelons of society. And that is where the development challenges really exist. So our experience during the crisis showed us that, there are lots of gaps there. We think that we know. We have a bit of literature here and there, but really we have a lot of work to do in that area. Secondly, we must promote approaches for processing and providing evidence at short notice and in simple format for policymakers to use. Again, during this crisis, we did not have a lot of time for our rigorous computations. That we do and did later, but the immediate requirements is simple, basic information that is going to guide an immediate response. And so we must really ensure that we invest quite a lot in terms of translating this evidence to the ordinary policy users and making sure that is can be done at short notice. And finally, that some of the evidence that is available and the recommendations are very difficult to interpret and sometimes are not exactly very useful. So we have huge volumes of information, very good for academic analytical work, but I think the way we translate them, the way we communicate them is sometimes demanding or wanting in terms of being useful to the ordinary policymakers. And finally, we must count on the lessons that we have learned in this process and in the past to inform the decisions that we make. Thank you, Chair. That is the end of my presentation, and I'm really looking forward to an interactive session with the participants. Thank you very much.
Thank you very much, Tom. We are happy. You know, the three issues you brought out are very, very crucial, making evidence simple, basic for quick utilization. I still remind the attendees to please put your questions in the question and answer box. I'm happy to call on John Lewis from Canada to just give us his presentation for the next 10 minutes. We are at 4:03, so I'm expecting John to finish by 10:13. John, you are welcome. Thank you.
Thank you very much, David. It's a pleasure to be here. I'm going to be talking about some of the lessons learned from the last 12 months supporting the Global Commission on Evidence to Address Societal Challenges, but it itself grew out of 24 months of supporting the COVID-19 evidence response across the full spectrum of public health measures, clinical management, health system arrangements, and economic and social responses. So back in April 2020, we brought together 55 partners from around the globe leading evidence synthesis, technology assessment, and guideline groups, and we've learned a huge amount from those collaborators around the globe. We also built out a Canadian network to respond to local Canadian issues. And I guess some of the things that have struck me are that we've never seen such demand before from political leaders, nor have we seen so much innovation on the evidence supply side. So some of the examples in Canada, monthly horizon scanning to get ahead of issues, really strong efforts to harness evidence demand. So 14 different governments across Canada could send in evidence requests to us. We could farm out the requests to more than 40 teams across the country, whoever was best positioned. And then the inventory and ultra rapid and living evidence syntheses, and I'll come back to those. But you'll see many groups here probably that are known to you that are part of the evidence support system from their jurisdiction, who we've had the good fortune to learn from. One of the things we've learned is we really can't continue to allow a low signal to noise ratio to be hallmarks of the evidence synthesis response to societal challenges like COVID-19. So if you look at the bar chart down below, wildly uneven coverage, very few syntheses about economic and social responses, very, very many about clinical management. Unfortunately, heartbreaking amounts of low quality syntheses. In light blue, typically 1 in 4 of the evidence syntheses are low quality. In gold, roughly 1 in 2 are only medium quality. And many, many evidence syntheses became rapidly outdated. And this is something we really need to get better on top of. Looking back, a global investment in an evolving suite of high quality living evidence syntheses would have saved us from tremendous amounts of research waste across the globe. One of the other lessons learned is we can't continue to respond to policymakers' questions with preprints, squeaky wheel experts, and old school expert panels instead of best evidence. So on the left-hand side of the scale, you'll see those preprints, the expert opinions, the expert panels having much more weight than best evidence. On the right-hand side, unfortunately, we continue to see select forms of evidence also being given much greater attention than a more balanced take on the forms of evidence. So data analytics, modeling, and one-off evaluation studies getting a lot of attention, much less attention to robustly developed evidence syntheses and guidelines. And if we want to understand problems and their causes, options to address them, implementation issues, then we really need a balance of these forms of evidence. Two of the achievements that our network put a huge amount of effort into were the COVID and inventory of evidence syntheses, trying to improve the signal to noise ratio. So now there are well over 13,000 evidence syntheses about COVID-19, but only 644 would meet our criterion for best. Recent search for evidence, high quality review, and ideally the availability of a great evidence profile. And other achievements include the emergence of ultra rapid and living evidence syntheses. So by month 16 of funding, 144 products, including some global public goods that can be used by people anywhere in the world, like these 3 living evidence syntheses about vaccine effectiveness, but also many evidence syntheses contextualized to the local context. So coming out of the first 12 months of the COVID-19 evidence response, we thought we have to do better in future, both with COVID and with all societal challenges. So we brought together 25 commissioners from around the globe. A few of them are on today's call with the goal of setting us up better to use evidence, both in routine times and in future global crises. The executive summary is available in 7 languages, and the full report will soon be available in all 7 as well. Lots of efforts to take particular messages coming out of the report and make them available, and most recently an editorial in Nature calling for better systems for turning evidence into action, which was written by Helen Pearson. So I'm going to talk about 3 next steps that we have, some at the country level, some at the global level, and then finally for making evidence part of everyday life. We're very, very focused right now on trying to work with partners in country to strengthen their evidence infrastructures through rapid learning and improvement processes. And this is going to be a big focus of our efforts in 2022. Very rapid jurisdictional assessments to find out what went well and address what didn't, both during and before the pandemic. And we've just heard from 2 colleagues who work in central government agencies, Prime Minister's Office, Office of the Presidency. We want to look both in those types of environments, but also in 3 other departments, or looking at other topics that cut across departments. And we want to know, what are the in-house units' capacity to mobilize evidence to support decision-making? What supports do they have available through formal partnerships with groups outside government? And what supports do they have available to them through the UN system entities that operate in their country, region, or globally? And really, we want to know, are they able to put local evidence alongside global evidence to inform decision making? What we want to come out of this is not a big academic report, but priorities for each country about what to systematize and what gaps to fill. And we're currently using a metaphor from the Olympics of a podium finish. So I'll walk through a couple of slides where I give examples using a podium finish metaphor about how we can do better. And it's meant to, in my case, show how in my own country, we were doing certain things during COVID-19 that could have been even better. And often in these slides, I have inspirational examples that we can draw from. So it's not meant to judge countries as a whole. It's meant to say, in very distinct areas, here is where you may be currently doing your work, but here's some inspirational examples that we hope will motivate you. So the first area is in the area of evidence products, and specifically evidence syntheses as a form of evidence. And so here we think a podium finish comes from relying on information emerging from living evidence syntheses, rather than what we've seen so much of during COVID-19, which is chasing the latest study without assessing its quality and putting it alongside all of the other studies addressing the same question. So in countries like my own, we've seen lots of in-house, meaning within government or organizations involved in COVID production, in-house production of annotated bibliographies without explicit quality assessments, often by these units that don't have in-house methods expertise, and often ones that aren't leveraging artificial intelligence approaches. You can contrast that with examples like COVID-NMA in France, the WHO BMJ living evidence syntheses. Both these groups are doing or maintaining living evidence syntheses of drug treatment. So you can go back every week and find whether and how the evidence has changed for any given drug treatment. On our side, we've been involved in a set of 3 living evidence syntheses through COVID-End, all focused on vaccine effectiveness, one looking specifically at adults, one at children, and a separate one on waning immunity. The adults one was updated every week initially, now every 2 weeks, the children every 2 weeks, and the waning immunity every 4 weeks. As you'll see in the lower left corner, living evidence syntheses add new evidence as it's made available based on its quality. So we have a continually evolving picture about what the entire evidence base, not just the newest studies, tell us. And good ones also describe how much certainty we can have about particular findings. And they don't accept the journal's peer review as synonymous with quality. So living evidence syntheses to us are really the future. That's what we need to be relying on. Now, if I turn to government science advice, here we think people can secure a podium finish by requiring science advisors to back up their statements with best evidence. During COVID-19, we saw a lot of unquestioning acceptance of the personal opinion of experts, and they were not challenged to say on what basis were they making their claims. So lower down on the bottom of the slide, off the podium, you'll see those personal opinions of experts in or engaged by many parts of government. So this is the case in my own country, but we did see some exemplary work being done. So there's one public health agency in my country where their public health experts were routinely supported by a combination of the best national evidence and the best global evidence. So those experts were able to speak in a way that enabled us to judge their accuracy. And we really should be, as we say in the lower left corner of this slide, be seeking out experts who can back up their statements with a description of how they identified, assessed, and interpreted the evidence they're drawing on. Now, if we turn to expert panels, here we think you can secure a podium finish by supporting living panels that develop truly evidence-based recommendations, as opposed to using old school and one-off expert panels. So again, using my own country as an example, we had at least 17 COVID-19 expert panels, but most of them were not following processes that yielded robust recommendations. We did have some exceptions. We had a National Advisory Committee on Immunization that developed high quality guidelines, but they were one-off guidelines. And they didn't supplement the guidelines on which immunizations to use, which vaccines to invest in, with guidance about how to get them to all those who need them. We looked with envy at Australia, who within weeks of declaring the pandemic set up a process for living guidelines, and they were updating their guidance as often as weekly and holding themselves to incredibly high standards. As we say in the lower left corner, expert panels, like the ones we saw in Australia, convene people with the right mix of issue-specific knowledge, evidence appraisal, expertise, and lived experience. At least the good ones do. Similarly, the good ones follow rigorous processes to develop their recommendations. And those expert panels that are living adjust their recommendations as the evidence and the situation evolve. So again, secure a podium finish by supporting living panels that develop truly evidence-based recommendations. If I turn briefly to the global level, these are some examples of how we're trying to enhance and leverage the global evidence architecture. Lots of opportunity for the UN system to move away from its expert knows best model for normative guidance and technical assistance, and to better invest in evidence-related global public goods. And again, here, countries like my own have really been free riding for a very long time and need to move up the podium to join countries like the UK, who've made multi-decade investments. The big area that we hope to work in is making evidence a part of everyday life. This is a massive career-long undertaking that we hope to join many others in pursuing. Finally, my final note, you can hear my alarm going off. Let's make this the year we position ourselves to go for the gold with evidence. We are very worried COVID-19 evidence investments will just expire and won't be redirected. It feels like this is the year when we really need to move to institutionalize the use of evidence in decision making. So that's a quick run through. I'll stop sharing my slides and turn it back to you, Chair David.
John, thank you very much. I'm glad that you set your alarm. This is very good, you know, and I think a common theme is coming, making evidence, you know, usage easy. And, you know, Harsha talked about evidence culture, and you are talking about everyday evidence use. That is really, really great. And it's a common theme that is running through. I will invite Dr. Shatter Research Fellow in Tropical Diseases, modeling at the Norfolk Basin at Oxford University.
Thank you very much, and good afternoon, everyone. So I'd like to perhaps share a few reflections on the talks that we've had so far, the very comprehensive talks that we've had from the start of today's session, focusing perhaps first on perhaps just raising one or two key points from each presentation. First, on the presentation by Professor Adnan Khan on the need for a customized, tailored local response to the COVID pandemic. And I think that's a very important point to bring up, because it speaks to the adage of, you know, having a single response or a single solution that might be applicable to all, and how that has in fact proven to be a fallacy. And looking forward, we have to consider how we can in fact develop these customized, tailored responses, tailored for each local setting. Also, to give a little bit of background on the perspective that I'm providing today, I'm an honorary research fellow at Oxford University, but my primary association is with the University of Cape Town in South Africa, where I'm an infectious disease modeler. And so my role during COVID was to support the South African government with providing modeling evidence. So I came from the perspective of scientists providing evidence to the decision makers, but also in supporting other countries on the continent as well. And so from this perspective, the idea of a customized and tailored response resonates, because this is exactly the kind of information that needs to be brought into models. And I think many models in COVID-19, particularly global models that treated all LMIC to be similar, it would have fallen down, because they may be applicable in general, but not applicable to a country who needs to make decisions based on them. One of the important points that was brought up by Harsha Dayal's presentation that resonated with me is this idea of resilience and solidarity in terms of what we're aiming for and how the scientific community needs to come together with the public sector and decision makers, your evidence brokers, as well as the private sector, to be able to support the health system and to support a resilient approach with the principles of solidarity. And so Harsha Dayal mentioned mixed methods studies, working together from different disciplinary groups, staying out of the siloed approach of economics being discussed in one forum and social and behavioral having another forum. One of the examples raised by Harsha Dayal was that of the Ministerial Advisory Committee in South Africa, and how this committee, of which I'm actually a member, needed to expand into having a social and behavioral aspect, as well as one specific for vaccines, another Ministerial Advisory Committee for medicines, as well as that which focused on health. And perhaps we could see that as one of the greatest flaws maybe in the decision-making approach, is not from the very beginning having an equal contribution between health and and livelihoods and social and behavioral aspects of society. That we had a COVID response, not just in South Africa, but I think in many countries, that was dominated by global influence as well, global pressure, but very much dominated by the health sector. One of the important points that Mr. Lubanga brought up in his presentation was that of agility. And I think agility here, we can address it from many facets. We could look at agility from the point of providing evidence to the decision makers, as well as agility from the perspective of the decision makers being able to enact and implement the policies. And from the side of the scientists, I think there's a lot that we could work on. Many of our speakers mentioned the way in which we communicate the evidence to policymakers in a way that is digestible, acceptable, and then can be easily operationalized. And so there are a variety of tools and engagements that one could do. For example, we could be looking at applications, so tools and applications that would be able to provide interaction or allow the users or the policymakers to interact with the models and with the evidence, the scientific evidence. We could have long-term relationships that are formed, so series of presentations and empowering relationships. The role of evidence brokers cannot be understated in terms of translating scientific evidence to policymakers. And this is also comes into play here is the public and private partnerships to enable these fora to have these channels of communication established and flowing from the evidence generators through the brokers through to the policymakers. When we look on the other side, the agility of the policymakers in terms of implementation, we then have to address the legal frameworks that will allow for money to flow from your central government to decentralized aspects of government, to allow for easy implementation and operation. I think at the end of the day, we need to remember that we may have the best policies, but it will be people who implement these policies, people at different levels of government, and not just the policies themselves are not the solution, but rather it's the implementation that matters. And from a scientist perspective, this is where I in particular found the role of evidence brokers to be key, because as much as we as scientists would communicate directly to national government, departments like department in which Harsha Dayal is a part of, when we came down to implementation, we relied on the data brokers, the evidence brokers, to take the scientific evidence from national and communicate this all the way down through to the district and the local levels to support the implementers in operationalizing these policies. And perhaps the last point that I'd like to round up on is from the last speaker, John Levis, where we addressed the point on evidence, on best evidence, and how we need to move away from focusing on preprints and qualitative, the old qualitative studies, the old ways of expert panels, and so on. And so the perspective I'd like to offer here is that I think that is correct in principle, but not necessarily applicable to all spaces. And from an LMIC perspective, I think that at least it has been my evidence in working in modeling in several governments, in several crises, is that we will almost never be able to get a full comprehensive data set or evidence base to understand the depths of economic inequality, social vulnerability in many LMIC. And so sometimes the best way to be able to build models, to create evidence, is in fact by relying on contextualizing whatever our scientific evidence or evidence that is being communicated to the decision makers, to contextualize them with local experts, so that they can be applicable to different groups of different income inequalities and social vulnerability statuses, and so on. And so I think that we've got to think about sustainability, and in preparing for future pandemics, do we expect that in the next 5 years, we're going to be able to have comprehensive data sets on all the heterogeneity that matters when it comes to decision making, and now particularly for LMIC? And the answer to that is most likely not. And so what are the systems that we can create now, the channels of communication, the local expert groups that we could create now to enable better decision making in the future? I think that's something that we have to give quite a bit of thought to prepare us for not necessarily just the next pandemic, but for even recovery of our health systems from the current one. Thanks. I'll leave it at that.
Thank you very much for the way you have been able to reflect on the previous discussions and how you have been able to link it, to the work we are doing. This is so profound, and we hope that we will be able to discuss it further during the question and answers. Our next panelist is Dr. Howard White, the Research Director for the CEDIL program, and the Director for Evaluation and Evidence Synthesis for GDN, and we are happy to have you. So Howard, it's your turn.
Thank you, David, and good afternoon, everybody. It's nice to have so many people here. So a lot of what I've said has been said already, particularly by John, so I will try to be brief. And I have 4 points I wish to make. So the first one is about preparedness. So a couple of weeks ago, I was listening to the BBC World Service, and it had an item about one of the world's largest warehouses, which is in Denmark. And this is not Amazon. This is a UNICEF warehouse for basically disaster relief kits. And so in the field of disaster relief, we fully understand preparedness. You don't wait for the disaster to happen and then start to get the stuff ready. We have the stuff ready beforehand. And so preparedness is precisely the point that John was making, is that we need to invest in the evidence architecture now, so that when the next crisis comes, we actually have the evidence to hand that we need to use. I've written before about what I've called the scandalous underinvestment in the evidence architecture, and this is precisely what I'm talking about, that we need to actually have a range of evidence across all sectors. So this is what Harsha called horizontal as well as vertical, because if you look in different sectors, we have many more studies, primary studies and reviews in health than we do in other sectors. So the Cochrane Clinical Trials database has 35 million clinical trials, whereas we typically have that sounds like a big number, but I think it's right. Whereas we typically have like 1,000 or so RCTs in social work or education, or 5,000 international development, but across across all different sectors. Now, if you look at systematic reviews, Epistemonicus has 35,000 health-related reviews. And then, but if you look at education, social welfare, there are again around 1,000 reviews in total. And the Campbell Library has only around 200 reviews compared to 8,000 plus in the Cochrane Library. So there's this huge underinvestment in the evidence architecture. The second, and again, John mentioned this, he called it institutionalizing use of evidence, which also is a term I would use, but basically improving the culture of decision making and understanding what evidence is. There's 2 points I'd make about that. One is to understand uncertainty, that there is uncertainty in evidence estimates. We don't know with certainty what will happen in response to intervention. We have a range of estimates. And another part of our understanding is to understand that actually that modeling is part of that. I was reading an article in the Spectator the other day on COVID, and in the comments, someone had written, "Oh, I stopped reading modeling." So as soon as someone sees modeling is mentioned, then they think, "Oh, this is not valid." And we have to understand the nature of evidence and where it comes from. What is the most reliable evidence that we have? We have to understand that, but decision makers need to understand that. The other thing is about transferability. I'm actually going to not contradict what Adnan and Harsha said, but actually say, to make an appeal for using the global evidence, so more in line with what John was saying, the global evidence when that's all that's available. So we should all be Bayesians. We should all base what we believe based on what knowledge we have and update our priors based on that. So here's an intervention, will it work or not? So 80% of things don't work. That's the 80% rule. 80% of interventions aren't effective. So as a good Bayesian, if I've got an intervention, my first assumption is this isn't going to work, because 80% of things don't work. All I know, if there's an intervention, 80% of interventions don't work, so it doesn't work. So let's now look at some evidence from elsewhere, preferably from a review, not a single study. Has this thing generally worked elsewhere? Oh, it has. So I'm going to update my prior saying, oh, this something actually might work. I still want to test it because evidence-based policy is not a blueprint approach. It's what's worked elsewhere. Let's try it and test it here and adapt it as need be. But at least we should be looking at global evidence to update our priors about what works, has what worked elsewhere, and be willing to take evidence from elsewhere. The third point, and this has come back, so Boris Johnson's been saying, build back better, which for those that work in disaster relief knows is something is commonly said after disaster. Okay, we're going to build back better. All our buildings fell down in the earthquake, so we're going to build it won't fall down when the next earthquake comes along. And so we want to actually have more resilient systems. So systems actually can withstand shocks. And again, we want to look at the evidence that allows us to have more resilient systems. And if you go back a year and a half ago, 2 years ago, people were saying, oh, we'll never go back to how it was. We've learned so much about, we don't need to travel, we don't need to go back to the office and so on. Now everyone's saying, I want to go back to the office. Please let me go back to the office. And so the idea that we're going to not go back to the way it was actually is slipping away. People are desperate to go back to the way it was. And so we do need to bear in mind, what have we learned about remote working and particularly actually online education? So I wrote a blog in the very early days of COVID about things we could do, like school shifting, later start times for adolescents, all year round learning, all of which evidence-based interventions would actually improve the school system and improve the resilience of the school system to withstanding shock. And of course, computer-based and home-based learning. And I didn't get much take up from that, but there is evidence there to inform policies in other sectors that would make the systems more resilient. And we should be thinking about that now, what evidence is there to building resilient systems. That's point 3. Fourth one is back to using evidence from other sectors. And again, Harsha referred to this, and South Africa was one of the countries where you could say this, but in Britain, you couldn't say this. In Britain, you couldn't say 2 years ago, stop focusing on the single metric of hospitalizations and deaths. And this was a big surprise to me, because I'm an economist. And what economists do is put a price on life. And a lot of people think that's horrific, but all decision makers are putting a price on life when we decide to buy that treatment, not that treatment. When we decide to build a motorway, we're trading in some extra traffic injuries and deaths for everyone else saving a few minutes on their travel times. So we make those decisions all the time. And what we want to do is make that explicit. And what we should have been doing from the start, and now people are starting to say this, oh, we should have traded off the cost, the social economic cost of lockdown measures on employment, mental health, and so on, against the health costs of not having those policies. And that's not saying which way we would come down on that decision. We may have well come down saying, okay, we've done the calculation, we've decided to lock down. But that conversation wasn't even allowed to happen 2 years ago in the UK. I actually got defriended on Facebook for raising questions like that by certain people. And so we need to have this horizontal approach that Harsha talked about, of actually looking at evidence from all sectors and having this culture of evidence-based decision making across all sectors, not just in the health sector. It was surprising, again, I'm speaking in the UK context, where SAGE was allowed to dominate, but SAGE, which was the UK policy expert committee, and SAGE was dominated by people looking at the numbers on COVID, and they consistently overestimated the numbers. And then just last month, the guys head of SAGE said, "Oh, we were just doing the health part. We thought someone else was going to look at the other parts." But he wasn't saying that 2 years ago. No one else was saying that. So this, and again, so Harsha said this, not focusing on a single metric really is important, and look at evidence from other parts as well. So 4 points: preparedness, be ready for the next time, and invest in the evidence architecture now, build the culture of understand what evidence is, to understand about uncertainty, understand about modeling, understand about transferability and the limits of transferability. 3, build more resilient systems now based on the evidence. And 4 is to understand that we use evidence across all sectors. It's not something unique to health. So thank you. David, that's all I have to say.
Thank you very much, Howard. So simple, so easy. And I think that the points that you have given are very, very practical, and hope that people who are listening to us today will really work on it. We really, really thank the panelists and the way they have been able to use their 10 minutes so effectively and efficiently to make their points so clear and crystal clear to all of us. We have 62 people online, but so far I have about 3 questions here that I will put across. The first question that I have here, I think they want to know, in the future, how does the panel believe we should avoid false information? For example, on relative harm versus benefit from vaccination being published in the news from preprints, which are then retracted but too late to avoid the concern being spread widely on social media. We are talking about the use of evidence. And I think it's John Lewis or Harsha who talk about, the quality of evidence. The question they are putting across today is that how do we avoid false information, false evidence that are being put along? How do we be able to distinguish between genuine evidence and false evidence? That is a question from a panelist. John, you can go.
Thanks very much. I guess a little bit of the answer comes from the argument I made around living evidence syntheses. For high stakes areas like COVID vaccines, the living evidence syntheses that I mentioned before were updated initially every week, now every 2 weeks. And in a super high stakes area, they could be updated daily if need be. So when the new preprint comes out, it should be immediately assessed for quality and then placed in the context of all the other ones that we have out there. And over time, we need to build a culture in which journalists and others know to ask that question, how does this fit in? So I think we can do some things on the evidence supply side, but there is a very helpful framework that we reproduced in the Evidence Commission report around all of the sources of misinformation and the potential strategies for addressing it. And there is an evolving database, an evolving evidence base on which to base your choice of strategies for countering misinformation. Unfortunately, to our knowledge, none of those evidence syntheses are living. And I think that's what we need to move towards, so that we know for particular instances of particular forms of misinformation, which strategies should we be using. And I see this as being a huge area of future growth. Misinformation is likely to get much worse before it gets better, and we need to have mechanisms to do it. But step one is make sure we have robust evidence products to which we can turn as the basis for countering it. And then second, we should be using the evolving evidence base on how to counter it most effectively in different contexts and for different types of issues. So those would be two quick responses.
I think, yes, I'm coming to you, Dr. because you talk about the rightness of an evidence. So you can take it from here. Okay.
Thank you. I'd like to add to my colleague's point to reflect on two other places where we can improve the use of correct evidence. So with the global evidence base that are provided and the global evidence reviews, one way of ensuring that this gets that this evidence is presented to decision makers at a national level is to have national expert groups who are in charge of reviewing and translating this information in a format that is acceptable and digestible by local policy makers. So that is one way of accelerating. And then we have to also remember the importance of the public digestion of this knowledge as well. And we need to, I think from that perspective, having a strong internal body, perhaps it's a national, the institute in charge of health data or health communication or management and so on, or even the national ministries of health with a strong social media component will be able to also spread the word effectively to the public via social media and other forms of media on what is false news and what is correct scientific evidence. And again, the importance of local experts and local government driving this is that the local governments will understand their populations best and therefore able to translate into appropriate languages and use formats such as, say, SMS formats in countries where data and social, and smartphones are not readily accessible, and so on. So I think it's good to consider the whole aspect, the evidence that gets fed into government, as well as the evidence that gets digested and implemented by the public. Thanks.
Great. Harsha, I have seen that your hands is up. If you can contribute to the question.
Thank you, David. I think John was first.
Harsha, you go ahead, please. I've had a chance to weigh in. I'll go after you.
Okay, thank you so much. So I think that, when it comes to this kind of questions around the infodemic and what I also mentioned, if you think about just from the evidence production perspective, and as researchers, and when you put your researcher hat on, a lot of the quality assurance and looking at the strength of evidence it always matters, right? Wherever you find yourself, whether it's in crisis mode or not. But from a perspective of broader public awareness and broader public good, where do you put your energy on? Do you work on strategies to avoid this, or do you rather work on strategies to mitigate this kind of messaging? Now, why I'm mentioning this is that, our communications units and our communication colleagues are never given that kind of opportunity to say how important their work actually is, because some of the messaging is actually working on this national psyche. And you see that transparency and how we project our information is always needed. But when there's fear behind it, when there's fear and anxiety, there's often a time to be able to message properly to deal with this fear. And then you get to the point of some kind of background intelligence that's needed as to where is this messaging coming from. Then we need our systems to be even more checked up to understand and source this kind of misinformation perspectives. So I think it becomes very clear that some of the misinformation, there's a very concerted effort that comes with the package, and there's a political drive behind some of those. And I'm not going to say it in terms of the scientific terminology, but there are certain colors and certain flags that get hosted as well. But from a perspective of public good and public awareness, it's the issue of solidarity that was mentioned by CEDIL, is to say that, you know what, if people feel for the next person, this is not about individualism. This is not about one person. This is about humanity. And even that is a cliche in itself. But at the same time, let us look at how messaging is done, where the strategies of misinformation needs to be focused on, because then do we chase after those that are not giving the right information, or do we actually counter that? And I think for me, the point is really about giving due and strengthening those resources that actually are, it's part of the job, and dealing with behavior. And sometimes we are at the point of local behavior, but it comes from an onset of leadership role models. It comes from the onset of politicians and other leaders, even church leaders, that play the positive roles. So there's a lot of work to be done in this space. And I think this is where does evidence actually becomes an activist role, that you can see evidence generation being used as activists in the process of just bridging between, and I'm talked about the brokering role, but bridging between those that produce and those that use evidence. So I'm going to stop there, Chair, and I just wanted to bring in another focus other than my research I had done. Thank you.
Thank you very much. John, before you come on, there is a question that is related, and maybe you can take it up. When and where does the strength of evidence matter more? And what are the implications of it? When and where does the strength of evidence matter more? And what are the implications of this? So you can take it up on that one.
Sure. So I just want to go back quickly to try to build the bridge between what seemed to be different views from me and CEDIL, who I guess she was a bit worried about my comments about holding expert panels and experts to higher standards, in part because it would mean that we would somehow then fail to contextualize evidence to local environments and to make sure that it was sensitive to the needs of diverse groups. But I guess I feel that national expert groups have tremendous potential to do what she's talking about if their members are selected in order to bring a mix of context, content knowledge, methods expertise, and lived experience. So I would like to see people from diverse communities, actual citizens sitting at those expert tables, but also the methods experts that can adjudicate the evidence that's being considered. And then I'd like to see them use very robust processes to do exactly what she's saying, which is contextualize the evidence for a given context, for different groups and so on, as opposed to seeing their role being to offer their personal opinion, but instead to engage with the evidence as it currently exists and to talk about what evidence may be missing and how do we contextualize what we know in a given setting. So I see those worldviews as being reconcilable, that we can have robust contextualization processes, and that we can have the right people sitting at the table to make sure that we're sensitive to the needs of diverse groups. And the same when it comes to experts. I don't think it's a bad thing to always ask the expert to say, can you back up your claim by sharing with us where that evidence is coming from? And I think experts do play a really critical role in helping contextualize evidence to particular contexts and issues. But we do need to ask them, where is the evidence coming from that they are helping to contextualize? Then when it comes to, I mean, that's a very big question. I should have been spending all of this time thinking about how to answer it. When and where does the strength of evidence matter? I've studied, my background is political science. I've studied the use of evidence in government policymaking for 25 years. And what we see are patterns of evidence use where it fits within the constraints that politicians are acting under. It aligns with the interest group pressures that they're experiencing. It aligns with their personal values or the values of their constituents, and so on. So there are political reasons why evidence matter in some circumstances rather than others. But if you move away a little bit from the politics, it can be the case that on more technical issues that have not been politicized, where values aren't as front and center, so more technical issues like this or that prescription drug, those are likely to be more amenable to high standards in the evidence that is required in order to make a decision. But my view is, we always need to be making decisions based on the best available evidence. And in the types of issues I deal with, how to strengthen health systems and get the right programs, services, and products to the people who need them, we don't have that kind of evidence that you have in the prescription drug world. We need to use what we have and put it alongside all of the other political factors that will ultimately influence decision making. So that's a bit of a ham-handed effort to address a very complex question.
Thank you. I think I'm happy that Professor Khan have stayed at this time, and Prof, I think you can contribute to the questions on the floor. Thank you, Prof.
Thank you. I just have one comment to what Howard said earlier. I agree with everything he said. External evidence, systematic evidence review, evidence from elsewhere is hugely important. And but with the only caveat that it should not be seen as a substitute for robust context-specific analysis, more seen as a complement, as a starting point, but not as a substitute. And one can see failures at both sides. One can see failure at not engaging with evidence that has been generated elsewhere or systematic reviews. But one can also see too much reliance being put on evidence from elsewhere, and that being seen as a substitute for rigorous context-specific analysis. So with just this caveat, I agree with everything that has been said.
Thank you very much. And I would like to really thank Prof for joining us, and also for all the panelists. This thing have been a very lively discussions, and it is a good start for the 3-day conference that is going on. We have dived through, the type of evidence to use. I was looking at my notes here, how to use evidence in our daily lives, how to make evidence use a culture, how to decentralize evidence use, and how to support evidence systems, the systems in place to really make evidence use feasible and in everyday life. I was looking at some of the reflections that have gone through today's presentation. Maybe if you live in a developed country, you appreciate evidence. The challenge that most people in developing country is not even the usage, but the quality of the evidence that we are generating, and how to synthesize the evidence packages for politicians, policymakers in developing countries. And I think Harsha was talking about low and middle income countries to be able to use it. These are the challenges, but the good thing about it is that we talk about the capacity. And John, I was so much impressed about, bringing the global bodies, together to really work on it. It's a part of the capacity building. And seeing Harsha now, working in South Africa now, being an honorary, visiting research fellow in Oxford, are all sort of the capacity building that we are working on. This world is going through a big crisis. We are now getting into the middle of the pandemic. We don't know what is going on. And I think being able to promote evidence use is something that we should shout and talk about it from all corners, because decisions are affecting everyday people's life. Without use of solid, sound, and contextualized evidence, decisions will be made in different political forums, in different arena, in different places, that will really have a negative impact on millions and millions of the world population. Thank you very much for your contribution. Thank you for the time that you have spent to prepare. And we, CEDIL, appreciate your contribution. This discussion can go on Twitter. I think we have the CEDIL Twitter, which is at CEDIL22. We can continue to have these discussions going on. And we invite you all also to join the next session that is going to run from the next session will be running immediately after this session, which is from 2 going, and we want you to join the session as we continue to talk about, using evidence in this pandemic period. Thank you very much. Thank you for attending, and thank you for preparing for this session.